somites, and somite actually itself divides into three parts. We call them as tome. Like the middlemost is the sclerotome, then in the middle we have myotome, and laterally we have the dermatome. We will be talking about these tomes in detail, but here you can just mention the middlemost sclerotome is going to form half of the vertebra, and not only it is going to form the vertebra, it is also forming the ribs which are attaching to the vertebra. So vertebra and ribs, they come from the sclerotome part of the somite, or it is the paraxial mesoderm. So what about the myotome? Myotome is going to form the muscles, as the name is suggesting. The skeletal muscles of our body develop from the myotome part of the somite, part of the paraxial mesoderm. Whereas if we are focusing upon the dermatome, dermatome is forming the dermis, the skin dermis. But be careful, the skin dermis is on the back region, like covering erector spinae. So as we have the erector spinae muscle on the back region, we are having a skin over that, that paraxial. The name is telling paraxial, so it is covering the skin which is paraxial on the back region. Now we will be focusing upon these tomes in a separate diagram, but let us come back in this region, and we have learned that we are going to have one intermediate mesoderm also. So this is going to be the intermediate mesoderm, and intermediate mesoderm is forming the major portion of the genitourinary system. That means it will have some derivatives like kidney, testis, ovaries. Now, when you are telling the kidney, testis, ovaries, the major portion of genitourinary system, it is the upper part, because lower part we have known it is coming from endoderm of the hindgut. And be careful that the genitourinary system will have some smooth muscles, so those smooth muscles also will be coming from the intermediate mesoderm. For example, the urinary bladder has a detrusor muscle. So detrusor of the urinary bladder is actually coming from the intermediate mesoderm, despite the fact that itself the epithelium may come from the endoderm of the hindgut. So understand that we are telling muscles of the genitourinary system, especially smooth muscles, they'll all come from the intermediate mesoderm.